Department on Disability Services Director. As always, I will start by sharing my screen and share our current data. Here we go. So to date, we have had 417 people who have tested positive for coronavirus. 7 in the month of March. People who are watching the data closely will notice that we also added one to the December number. We had a report from someone who lived at home of coronavirus that they had not wished to previously disclose. So broken down by placement type, we've had 6 people in host homes, 114 people in intermediate care facilities, 1 in a mental health facility, 52 in their natural homes, 2 in a nursing home, 4 in out-of-state placements, 37 in residential habilitation, and 201 in supported living. Of these, of the 114 people in intermediate care facilities, this represents 38% of people in ICFs who have contracted COVID. Of people who have contracted COVID that live in ICFs, we've had 23 deaths, although only 12 of those to date have been confirmed as COVID related deaths, as confirmed as COVID being the cause of death. And so that accounts for about 10.5%. In natural homes, the 52 people account for about 5.6% of people who are in natural homes that we support. And of these, there have been 5 deaths, all of which are confirmed as COVID related, representing a 9.6% death rate. In residential habilitation, the 37 people represent about close to 34% of the people in residential habilitation who have contracted COVID. Of those, 3 have died. 2 are confirmed as COVID related, representing 5.4%. And then in supported living, 201 people have contracted COVID, which represents about 21.5% of the total. Of those, 20 have died and 14 are confirmed as COVID related, representing just about 7%. Overall, there have been 17.4% of people supported by DDA who have contracted COVID. And of those confirmed COVID deaths, there have been 35, and there have been 54 people who have died. Just to jump ahead a little bit, someone raised a question last week about how do these numbers compare with people in nursing homes. And so let me just say, it's difficult to make a comparison as you look at sort of numbers and percentages. However, I would invite anyone who's interested to look at the data, and you can draw your own conclusions about the comparisons. You can find that data at coronavirus.dc.gov. And when you go there under data, look at COVID-19 surveillance. And then right at near the top of the page, it says download a copy of DC COVID-19 data. And there is a tab on, one of the tabs is entitled long-term care facilities, and it gives you data on every individual facility. The reason it's difficult to compare is that they have the number of cases and the bed capacity, keeping in mind that some of the, especially in skilled nursing facilities, you've got people moving through there. So, the total number served in a year could be higher than the bed capacity, and there's the potential to not have the full bed capacity. So percentages in that regard can't really be compared. Assisted living facilities are also listed, and to some degree, those can be compared. So I'd invite you to look at those numbers as well. What was interesting to me in looking at that is that when you look at the number of people in each of those kinds of facility who lost their lives compared to the number who contracted COVID, in assisted living facilities, it appears to be about 25%. And in the skilled nursing facilities, it was 20%. And those would be confirmed COVID deaths. So in the month of March in SL supported living, we've had 5 people contract COVID and 2 in a natural home. And people who have required inpatient treatment, 1 person who is currently hospitalized. And then, excuse me, people with COVID-19 who have died. In March, there have been 2, and there have been a total now of 54. And of those 54, 11 have been confirmed as not COVID related, and we are still awaiting confirmation on 8. So that the total confirmed COVID related death is still 35. I will say that both of the deaths in March occurred shortly after the person had COVID. And so, we're waiting to see what OCME says. It's, as I've said before, we have some instances where people had COVID in April and then died months later. That's maybe more questionable. These were shortly after, but in every instance, we wait to see the confirmed cause of death as reported by the Office of the Chief Medical Examiner or by the local medical examiner in instances where the death occurs in Maryland. So in terms of provider staff, there were 6 additional provider staff who tested positive for COVID this week for a total of 666. 48 of these staff work for more than one provider, and sadly, 10 staff to date have died. So a question that I've mentioned before that I anticipate around this time and that we start hearing right around now is, when will my stimulus check arrive? And what people should be reminded of is that stimulus checks that came, I believe it was like last May, they don't count toward your assets until after 1 year, which means that we're getting to the point where the funds that people were paid last May will count toward assets. So this week, we have with us David Rydzeski, who is from the DC ABLE Foundation. And he will speak with folks about ABLE, ABLE accounts, so that people can hear about one option for saving that money in a way that will keep them from having issues with their amount of resources. So I'll now turn it over to David. And you should be able to share at this point, I believe, so that you could pull up your presentation.
Hi, can everybody hear me?
Yes.
Excellent. Okay, let me see if I can share my screen now. Can everybody see these slides?
I can.
Okay. Let me start and let me move this little WebEx screen over to another area so I can see better. Hello, everybody. My name is Dave Rydzeski. I'm the Institutional Relationship Manager for the DC Able Alliance program. I also am the Institutional Relationship Manager for the DC College Savings Plan. Now, I'm not sure if you're familiar with DC College Savings Plan, but both DC Able and DC College Savings Plan have some similar benefits, though they're different programs. The DC Able program is part of the National Able Alliance, which is a partnership of multiple states that's dedicated to providing an investment option at a very low cost that's protected from the resource limitations that you have with getting SSI and other types of state grants. So let's talk about DC Able for a bit. It's basically giving those with disabilities the ability to save for their everyday life experiences. DC Able was launched back in July of 2017 by the DC Office of the Chief Financial Officer, and specifically the Office of Finance and Treasury. What this means is DC Able is a DC government plan created by DC Council, signed into law by the mayor, and again, it's administered by the Office of the Chief Financial Officer. DC Able, again, is a member of this national alliance. It's a program that's managed by an investment group called a census. They're the chief record keeper for all of the services that encompass DC Able. The National Alliance is a partnership of 18 states dedicated to providing those with disabilities an investment product that offers multiple financial options at a very low cost. DC Able helps families with individuals that have a disability that, again, help them save for their everyday life experiences on a tax-free basis, and also to preserve their ability to benefit from supplemental programs like SSI, Medicaid, and other programs. So let's talk about the features of DC Able. There are special tax advantages if you own a DC Able account. The earnings will be compounded on a tax-deferred basis that maximizes your return. Not having the tax man get into your pocket as you're trying to save is a very big benefit. And as long as you're making withdrawals to be used for your everyday life experiences that are qualified, all withdrawals are 100% completely tax-free. Federal, state, and in this case, DC city taxes. So there will be no impact on your current benefits whatsoever as long as your balance stays below $100,000 or at $100,000. And it will be excluded from the SSI resource limit. And it's only when the account reaches over $100,000 that those funds would be counted against your resource limit. I was given a question about sharing the slide deck. Unfortunately, I cannot share the slide deck, and it's basically for copyright and liability reasons. But if anybody ever would like me to present to another group or to speak with anybody on an individual basis, I am here for you, so reach out and let me know. Going back to the slideshow itself, that if you're able to exceed that SSI resource limit, at that point your SSI benefits may be suspended and your ABLE account may no longer exceed, because your ABLE account no longer is lower than that resource limit. You'll continue to be eligible for Medicaid benefits regardless of your account balance. So that's a good thing. I missed that last question that somebody had. Bear with me for a second. Question was about funding an ABLE account, and yes, you can actually fund the account online, and just go to the Save with ABLE website, and I'll give it to you at the end. But yes, you can electronically forward money to your ABLE account. And I think that that's it for now. Let me go back to the presentation itself. Thank you very much for your patience. You can open an ABLE account online with as little as $25. Access to the account can be enabled by phone or online 24/7 from a PC, tablet, or mobile device. I'm going to take a lot of these questions, if you don't mind, later at the end because it's breaking into the presentation itself. You can select the checking option, which will give you a debit card, so you'll always have easy access to your funds. The DC ABLE plan will allow you to keep an account balance up to $500,000. But again, remember that SSI resource limits might come into play if you have a balance over $100,000. But legally within the DC ABLE plan, you can have an account balance up to $500,000. And you could also contribute up to $15,000 per year. So folks might want to know, how much does DC ABLE cost? Well, they range from as little as 0.34% to as high as 0.38%. What that means is if you were investing $100,000 in your DC ABLE account, you'd be paying internal expenses of between $3.40 to $3.80 for every $1,000. Each account is charged a maintenance fee of $15 per quarter, which comes out to about $60 annually. Now, these fees can be discounted by $3.75 if you do everything through e-delivery of statements and confirmations. And also, if you are a DC resident, you can have those charges discounted another $1.25 per quarter. The fees are taken directly out of your account assets, so there is nothing to pay on top of that. If you invest in the checking option, there is an additional monthly fee of $2 that will be applied to your account. This fee is waived if your account has an average daily balance of over $250, or if you select electronic statements for delivery with the bank that we utilize, which is called Fifth Third Bank. Who's eligible for a DC ABLE account? Any eligible individual can open an account for themselves or have an authorized individual open the account on their behalf. The eligible individual must be entitled to SSI or SSDI because of their disability, and their disability must have been diagnosed before the age of 26. The individual who is eligible for ABLE must certify that they've had that physical or mental disability and that it can be expected to last for at least a year or can cause death, or if they are blind, or their disability is included within the Social Security Administration's list of compassionate allowances conditions. And blindness or disability, again, occurred before the age of 26. Now, there are 7 different investment options, including the checking option, okay? So they range in terms of matching your goals and your comfort with risk. So they range from aggressive investment options with higher returns to conservative investment options that place capital preservation as maximum priority over growth. And the choices are going to be ABLE for any investor. Just move this out of my way. And you can also contribute to that checking account. It's an FDIC insured checking account through Fifth Third Bank that allows you to withdraw money using a debit card or by simply writing a check. This allows you to easily use your funds for your everyday life expenses related to your disability. Now, I'm going to stop there and try to check chat and see if I can answer some questions, okay? How are withdrawals monitored to prevent exploitation? Well, the withdrawals are monitored by the DC ABLE customer service area, which is controlled by the program or investment manager by the name of a census. So if there are any type of withdrawals that seem unusual, the accounts will be flagged and reviewed. You'll also have the responsible person or the eligible ABLE individual contacted immediately. Another question is, how are the disposition of funds when a person becomes deceased? At that point, Social Security benefits could be clawed back by the federal government because those funds are basically theirs. And when the person that's deceased becomes deceased, the federal government has the right to get those funds back. That has been a bone of contention to many folks, but it's just federal law. It's nothing that we can do about it. Next is, who's responsible for reviewing the financial records or contributions and distributions of the funds? A census is not the quote unquote financial police, but they do take control to make sure any distributions are for qualified expenses. So if they're not for qualified expenses, that's when the federal government and the tax man may get involved. Another one is, how often are statements distributed for persons with ABLE accounts? It's done on a quarterly basis. And to save from these added fees, we encourage you to do all of your account processing through online or e-delivery purposes. There's a question about, are the providers able to attach themselves to an individual's account? If you mean by providers, either DC government or a census, the investment manager, the answer is no. We actually are the investment manager, but can't actually make the decision to withdraw funds. Only the authorized individual or the able individual can make those decisions. Who is, let me, bear with me for 1 second. Who is considered an authorized representative that can open these accounts on behalf of a person? That would be someone with most likely power of attorney. There are no, question is, are there Fifth Third ATMs in the area? No, there are no Fifth Third branches in the area. They're based in the Midwest, but all ATMs that are in their system, and again, they have contractual obligations that are reciprocal with other banks, so there will be no added ATM fees involved on most bases, and there would be a whole list of ATMs you can go to. And what are qualified expenses? We'll get to that in another slide if you don't mind, but basically your everyday life experiences that are due to your disability. So with your permission, I'm going to stop there, and then we're going to continue for a few minutes with more slides. So how do I open up an ABLE account? Well, go to dc.savewithable.com to learn more about the program and also to enroll online. There's also a customer service number, and I'll leave it on the screen at the end so you can get to that information again. And customer service is there Monday through Friday, 8 a.m. to 5 p.m. to help guide you to make the right choices for you and your family. And if you'd like to email us, the email address is on the screen, and I'll come back to it at the end. And there's mailing addresses for you I'll bring back up at the end of the presentation. So let's get to some frequently asked questions. Do you have to prove eligibility? The answer is no. However, you should have a record of a doctor's signed diagnosis and benefits verification letter from the Social Security Administration or other relevant documentation in case it's needed. And another question is, do I have to prove that withdrawals are for qualified disability expenses? Not at the time of withdrawal. Annually, DC ABLE will report the total amount of your withdrawals to the IRS and the date and the amount of each of your withdrawals to the Social Security Administration. In the event that either entity wants to verify that expense, it's recommended that you keep good, detailed records. So please save your receipts. Another question is, can I have more than one DC ABLE account? The answer is no. You're limited to one ABLE account, except in the case of a rollover from another qualified ABLE plan. This extends beyond DC ABLE to include other ABLE programs in other states. In the case of a rollover to another ABLE account from the same account owner, the account from which the funds are withdrawn must be closed within 60 days of that withdrawal. Another question, can family and friends make contributions into the account? The answer is absolutely. Anyone can contribute directly to your DC ABLE account. No matter who contributes, you, the account owner or authorized individual, retain control over the account. Keep in mind that contributions made by you are considered income for means-tested programs. Another question, how often can I change my investments? You're legally allowed to change your investments twice per calendar year. You can change your investment options for any new contributions at any time. Now for the legalese portion of my presentation. The DC ABLE plan is administered by the District of Columbia and through the Office of the Chief Financial Officer. A census is the investment program manager and chief record keeper and responsible for the day-to-day operations of all services. Okay, the plan's investment options are actually managed by a census and are qualified through the IRS code 529A for you to get these tax benefits. Okay, all of this material that we're talking about today is for educational purposes only and is not intended to provide you with investment advice or tax counsel. Okay, and participation in the plan does not guarantee that contributions or returns would be able to cover all of your future expenses. So that's the legalese portion of my presentation. So let me go to another slide that'll bring up some qualified expenses. Just bear with me. I'm going to stop sharing this screen, but I'll come back to it just to give you that information about where to call and the website. Bear with me. I'm almost there. Okay. If I can, I want to share another screen. Bear with me. It's right here. Okay. Can everybody see that screen?
Yes.
Okay. These are some of the qualified expenses. Things like education, housing, transportation, employment training and support, technology and personal support services, health, prevention and wellness, financial management, legal fees, expenses for oversight and monitoring, basic living expenses, and also funeral and burial expenses. Let me stop there and open it up to see if there are more questions. I seem to have lost chat, but does anybody know if anybody has questions?
I could read the questions to you.
Sure, that's great, thank you.
So, and is there a beneficiary form required and associated with ABLE accounts? You mentioned that the federal government can request the funds be returned for deceased persons. Is this done automatically?
I don't want to speak for either the federal government or any state because I don't want to be represented as legal counsel. I can tell you that state entities and federal entities do have the right to get any remaining assets back. So the answer is no, there is no beneficiary form.
If DDS is the representative payee, how do we get visibility of established ABLE account balances quarterly?
You would have access to all account information as the either authorized person or the able individual. So you would log into your account and have access to all transactions.
So there's a comment here that I think also addresses that. So it's our understanding that authorized representative could include power of attorney, court-appointed general guardian, court-appointed conservative or trustee, or a court-appointed limited guardian who's been given specific authority from the court to assist with this task. Can you confirm that?
Yes, this is all correct information.
Could you explain basic living expenses in more detail? For example, spending money for recreation, food, vacations.
It's my understanding it won't include vacations, but basic everyday life experiences would include things like food, housing, clothing, household supplies, cleaning supplies, things like that. But it won't include things like vacations.
I think that's it on the questions so far.
Okay. How are we running on time?
They're the only questions I've seen, so I think you're doing fine.
Okay, no, I just want to make sure that I'm not going over because I don't want to take up any more of your time. But I'm here in case you need me, and I'll stay on. If you want to move on and go to another topic, I'll stay on if there are questions later.
That sounds great. And as soon as this is what always happens, as soon as you say I'll move on, then the questions come in. So, how about furniture? Is that considered a basic living expense?
Yep, I believe that that's going to be under housing and household supplies.
And the cell phone bill?
I know in the DC College Savings Plan, cell phone bill is not allowed, but I would believe that that would be considered a basic living expense under ABLE. I would contact customer service, or if you'd like, I believe my email address was shared. I'd be more than happy to look into it, email you back.
Yeah, for people, the email address was put in the chat, I thought. There it is. And so for people who are on their phone, his email address is David.Rydzewski. It's Rydzeki at Ascensus, ASCENSUS.com. Okay, that seems to be all the questions for now, but thanks for being available. If more come in, we are still here, and they will, for about 20 more minutes. How do you separate stimulus money from SSA money in the ABLE account?
To be perfectly honest, that is above my pay grade, but I am positive that I can find somebody that can give you that answer. So if you want to email me, I'll follow up and come back to you with a better answer.
And can you pay family expenses, like, for example, your children's basic living expenses?
I don't believe so. I am going to double check on that. I believe it has to be your everyday life experiences, no other family members.
Will these slides be posted and where? No, they will not be posted, unfortunately, because of some copyright issues. However, I've provided David's email address. He'd be happy, as he said, to answer any questions or to do a presentation elsewhere. But the slides themselves can't be posted.
And also the dc.savewithable.com address will address all of these same questions. Maybe not all of them, like how do you segregate the stimulus question or stimulus payment from other payments. But with that said, I'm going to work very hard to get you the answers or get you to the right folks.
Oh, someone had a question about recreational activities. I heard the question about vacations, and the answer was no. So,
Right. Vacations is no. I would believe, and again, I can double check on this, I think recreational expenses would be approved as long as it dealt with your physical disability and need for exercise.
okay, thank you. And so we do still have about 15 minutes. As always, we have folks from DC Health here as well, if there are questions for them. And so we're available for any questions you may have about the presentation regarding ABLE accounts or any other questions.
By the way, I want to say that all of the questions were very good and the audience has been excellent. So thank you for the opportunity to speak with you today.
So can you confirm your email or your mailing address for your office? This has a Kansas City address, DC Able, PO Box 219235, Kansas City, Missouri, 64121.
Yes. I'll bring up the other slide with the address for you just after I answer this question. But yes, that is an office that's administrative for the investment/program manager by the name of a census. They have an administrative, I guess, series of offices in Kansas City. So I'm going to stop sharing. I'm going to bring up the screen with the addresses again, just in case you need it. Does everybody see that?
No.
Okay, let me get to it. Bear with me again. I apologize. Oh, I'm having trouble with my mouse. There we go. Let me share. Okay, can you see that now?
Yes.
Okay. Thank you for your patience, everybody.
Well, so far we don't have other questions. I will just kind of reiterate for people. We had another 2 days this week or DC Health, along with Giant, had another 2 days of vaccine clinic this week at the Kenilworth Recreation Center. There are 2 days scheduled next week as well. We have in MCIS a place where providers are now starting to upload all of the vaccination documentation, and we are getting a complete, we're having more complete data on both the people we support and staff. And so we'll be able to provide a complete report on that, I believe, next week. I will say yesterday we had a really good provider leadership meeting, and at that meeting we had a few providers talk about the strategies that each of them has used with their staff and the people they support in encouraging people to get the COVID-19 vaccine. And some of our providers are seeing really good outcomes, a variety of different strategies, but I will say that what was consistent throughout all of them was the need for ongoing education, for hearing from people about what their concerns are and providing as much specific responses to those concerns so that people would understand the benefits of getting a vaccine. And I will say we have some providers who are either at or very close to 100% of staff and people they support, which is amazing. And I'm hopeful that the technical assistance from each other this week will help other providers in expanding the percentage of their folks who are also getting the vaccine, in terms of the people they support and their staff. And, just as a reminder, as I said, this is available at MCIS, so it's really essential that providers remember to upload the information in MCIS. We sent out instructions, step-by-step instructions about how to do that so that we can accurately represent our data there. Will we be sending addresses of places where people can get the vaccine? Well, people can. The best place to go to get information about the vaccine for folks who live in the district or work in the district is to go to coronavirus.dc.gov, and you can find the information there about the various different ways to register for to get a vaccine. The DC portal has the ability to register, and once you register, you provide information that relates to your eligibility to get a vaccine. And as soon as you are eligible and vaccine is available, you are sent an email or sent a request to log in and schedule your vaccine. You have 48 hours then to do so, or else the window closes on that and you're put back on the list. You don't lose your opportunity, but just for that particular session you do. And also on that website, before you get down to registering in that portal, there's a whole list of both the hospitals in DC. If you've gotten care there and are in their system, you can register to get a vaccine with them. Or if you're connected to one of the various health providers who have vaccine available, you can log in and register there. If you're able, you can log into every one of those options and see which line you get to the front of first. We just encourage people, when you are able, to get a vaccine. Do we have compiled data on the total number of people supported who have been vaccinated and the provider staff who've been vaccinated? So as I said, we're compiling that now. We have numbers, but I don't think they are total yet. We added the tab in MCIS for providers to upload the documentation last week. So the information we have now is not yet complete, but we are getting there. And we are collecting from providers, provider staff information. We're getting aggregate data from the providers because we're not asking providers to give individual health information about their staff, but we are asking that they report on the total numbers. And those numbers are moving along. It appeared to me most recently that we were above 30% of DSPs who've been vaccinated. Or who are in the process either of the first shot or having completed vaccination. But as I said, we will have complete data and make a report on both of those next Friday. More complete data. So there is a question about incident reporting. And as I read it, it's good for this forum, but I just want to remind people if you have questions that are about sort of day-to-day issues regarding procedures, DDA procedures or provider procedures, please don't wait until Friday to ask those questions. Give the appropriate quality resource specialist, service coordinator, or respective supervisor a call. But this is a good question to ask in this forum, which is our incident manager shared this week that at a recent incident management committee meeting, they were told that any instance of a staff observed with their mask not on appropriately should be reported as neglect in MCIS. Just wanting to verify if this is written guidance or if this is anecdotal. I don't think those are the two choices. I will say I don't believe there's a written guidance that says that, but I do believe that having a staff member who's not practicing the required safety measures is neglect and should be reported as such. Winslow might want to comment further on that, but you can look at the definitions of neglect, and I think that not taking medically recommended steps to ensure that people who are in your care do not catch a contagious and potentially fatal illness probably qualifies as neglect.
Yeah, I couldn't have said it better, Director Reese. And I would like to also recommend that when you have questions like this, we're here Monday through Friday. Usually I'm here in the office 9 to sometimes 7 in the evening, and my cell phone is always on. This question may be a question that many on this forum don't know, but it's absolutely neglect, and you summed it up perfectly. There's been a directive and guidance from DC Health that has been issued. We've shared transmittals on those particular guidances. And the reality of it is, if you went into a hospital or a nursing home, an ICF, or any supported setting, and you saw that a staff person was not wearing a mask, they would absolutely not be respecting the CDC and DC Health's guidance on mitigation strategies for the prevention of the spread of COVID-19. So I'm glad you asked that question, because there may have been someone else who didn't know that.
If I can interrupt real quick too, I don't want to put her on the spot, but Karen and I spoke about this earlier in the week as well for DC Health licensed facilities. Karen, are you on?
Yes, I'm on. Good afternoon.
Good afternoon. Just wanted to, reiterate what we talked about earlier in the week, just the fact that DC Health takes it very seriously in ICFs and CRFs. And, I don't know if there's anything you want to add to that, Karen.
Absolutely. I absolutely agree with everything that Director Reese and Mr. Woodland have already have said. As you know, we are performing our annual inspections of the ICFs and the CRFs. And just here recently, it has almost become commonplace that we have seen staff members either not wearing the proper PPE or not wearing it correctly, which is pretty much the same in our book. And it really does get a little frustrating when we've been in this for about a year. And DC Health is committed to working with DDS and making sure that steps are taken to mitigate the spread of COVID. And at this point, we are just really making sure that the facilities are understanding the severity of it, and we will be taking the next step in order to make sure that these things can be getting across, because it is about the health and safety not only of the residents but of the other staff as well. So thank you so much for the question and for the answers that were provided.
I also want to call people's attention to a note that Morgan Whitlatch from Quality Trust put in the chat, which is that you can get more information on ABLE accounts and Medicaid payback if you go to www.ablenrc.org/WP-content /07/07/ABLE-and-Medicaid-webinar PDF. So that link is right there in the chat for people who are participating by WebEx on their computer, and you can link to that and get that document. So it is a little bit after 1. I don't see any other questions. So I don't see any other questions at this time. I want to remind people, David has provided his contact information so that you can follow up with more information about the ABLE accounts from him individually. And as always, have a nice weekend. We'll talk with everyone next Friday. Let me just call people's attention. You should have gotten or will be getting a notice. Our forum on April the 23rd will be 2 hours, and we will be talking about, we'll be doing our budget forum. We're on a really tight time frame this year. The mayor's budget comes out on the 22nd. And at this time, our hearing is scheduled for the 27th. And so so we will be doing a presentation the day after the mayor's budget comes out on the DDS budget. And that will be 2 hours. There is also, thank you very much, there was an additional note in the chat. You can just go to the www.ablenrc.org website, and it has all kinds of good information on ABLE accounts. It's the National Resource Center for ABLE. Okay, have a good week. And just as I hear about the issues with, whether people are wearing masks, whether they're wearing them appropriately, the reminder from DC Health and DDA, as I hear good news about the vaccine, please don't let that good news cause people to think that that means that we can relax any of our other safety measures. We have to continue to ensure that people remain safe until we all get to the complete end of this. And that means always, when you're not with household members, wearing appropriate face covering, keeping appropriate physical distance, and regularly washing your hands. All of this, it's so important that we maintain this. Without sharing anyone's individual specific information, one of the cases, I know they're way down now, but one of those that we added this month was a person who had just gotten not soon enough for there to be immunity, just gotten their first vaccine, and then gets COVID. And so, it is essential that we continue to take all of the necessary steps to continue to protect ourselves and those around us. So with that, thanks a lot, and I will talk with everyone next week.
Thank you, everybody.